Hi there, this is your favorite nurse practitioner, Pattye Anderson, and I want to have a discussion with you today about weight loss and how to manage side effects from GLP-1 medications. You may have heard about GLP-1 medications, but have hesitated requesting one from your nurse practitioner, physician's assistant, or medical doctor. Glucagon-like peptide 1 or GLP-1 medications have become a powerful weight loss tool in a country where 40% of the population is obese. Patients taking these medications can experience weight loss, a life-changing amount for those who have been struggling with weight and related health problems for much of their lives. But despite substantial weight loss, many people find staying on these medications difficult because of a lengthy list of uncomfortable side effects, including nausea, vomiting, constipation, gastroparesis, dehydration, and gallstones. And in some cases, patients undergoing surgery have also experienced some more serious digestive side effects, including aspiration of foods into their lungs. Still, experts contend that before discontinuing a GLP-1 medication, patients should consider adjusting the dose, taking prescribed and over-the-counter medications that help with symptom management, discussing the symptoms with their primary clinician, and making dietary changes that will allow you to achieve weight loss without sacrificing your quality of life. It is worth noting that while these symptoms are called side effects, the drug is actually doing exactly what it's supposed to do: slow gastric emptying so that you feel fuller longer and can lose weight. Slowed digestion causes food to sit in the stomach, which in turn leads to sometimes unpleasant symptoms. Correct dosage and dietary changes can help with side effects. The first step in reducing side effects, the most common of which is nausea, is pinpointing your ideal dosage. Symptoms usually occur when the dosage is escalated. As a result, it is best to gradually increase the dosage over several weeks so that as a patient, you are losing enough weight, but you are not overwhelmed by side effects. If you are having difficulty tolerating the drug, it is important to consider asking for a lower dosage or at least delaying any increase until you are able to adjust to the medication. Diet also plays an important role. As a patient, you should be eating many small meals throughout the day that are easier to digest. I'll say that again. You should be eating several small meals throughout the day that are easier to digest. So even when the dosage is low enough that you aren't feeling any side effect, starting off with smaller meals will help you to establish positive eating habits once the dosage is increased. This avoids getting overly full, which can also create a sense of nausea and other gastrointestinal side effects. Consuming plenty of fiber is also important for tolerating these medications, whether it's coming from whole grains, fruits, or vegetables, or in the event that some patients who aren't getting enough fiber from food, supplementing with a over-the-counter supplement to reach 25 to 35 grams daily will help. It is often difficult to get enough fiber because some patients aren't eating enough fiber. They're eating very little. So supplementation can be the key. Adding fiber supplements to your coffee, water, or smoothie can be helpful. And you should avoid artificial sweeteners, especially sorbitol, mannitol, xylitol, and maltitol in candy, gum, and beverages because these can add to stomach discomfort. Dehydration is important to avoid, so staying hydrated is important to staving off constipation. Often, if you don't feel hungry, you might end up not drinking enough water because it could make you feel overly full. Heavier foods that take longer to digest also tend to make people feel poorly. These foods include high-fat foods like fried foods or fattier meats, especially red meats. Some clients have an aversion to alcohol because it doesn't settle well and it also slows digestion. In some cases, a temporary liquid diet can reduce symptoms. Allowing the bowels to rest via a liquid diet can reduce nausea and vomiting symptoms. So consider foods like protein or meal replacement shakes, or simply blending up a healthy meal. Any meal that you blend up that you can drink through a wide straw is a blended meal replacement. Prescribed and over-the-counter medication interventions can be used to help with your symptoms. So you can obtain a prescription to manage your side effects, and you can also use a over-the-counter medication to help with the symptoms of slowed gastric emptying. For the most part, nausea, the most common complaint, can be treated with an over-the-counter medication. Simply ask your pharmacist. In addition to more common unpleasant symptoms, some rare but serious side effects have been associated with GLP-1 medications. The use of GLP-1 medications and gallbladder disease, for example, gallstones, is important to note. And while these are rare, some experts contend that the symptoms could be the result of extreme weight loss rather than the medication itself. Also, in patients who are undergoing surgery that requires anesthesia, GLP-1s can increase the risk of pulmonary aspiration when a patient is under deep sedation during surgery. This can cause aspiration into the lungs or aspiration pneumonia, which is a lung infection that occurs when food or liquid is inhaled into the lungs. Routine fasting before surgery does not seem to be enough, so it is suggested that patients stop taking these medications at least 1 to 2 weeks prior to surgery. The bottom line is, when it comes to tolerating GLP-1 medications, it is your quality of life. In order to sustain the weight loss, you really have to stay on the medications. And while watching the scale tick down can be exciting, if these medications are keeping you from doing the things that you enjoy, they might not be worth it. In this case, consider a lower dosage, or maybe you have to get off of them entirely. It's worth revisiting what's important as well as what's sustainable for your weight loss in the long term. This has been your favorite nurse practitioner, Pattye Anderson, with a discussion about weight loss and how to manage side effects from GLP-1s. If you want an individual consultation, don't hesitate to reach out to me at nursepatty@gmail.com. Thanks so much for your attention. I look forward to you forwarding, sharing, and liking this post and commenting. Ta-ta for now.